What's up, everybody? Connor here, reporting for duty. Week 8 out of 12 in the bag. Starting week 9 tomorrow. And then just 3 weeks left. Pretty crazy. I mean, heck, once this next week starts, it's as good as over. And then, bam, 2 weeks left. It's getting crazy. But super exciting. Can't wait to be done. Not because I don't like the clinic, but just because I'm super excited to finish with the classes and get into the work. Um, this last week, I still been working with pretty similar patient load or caseload, so doing 2+ patients an hour. Been working with a lot of Medicare patients lately. So, giving them a little bit of extra attention. Also having to deal with the whole billing thing when it comes to having several Medicare patients on the schedule at once. You got to bill group, I guess. Reimbursement is always tricky. So yeah, learning that whole side of things, which is good. Starting to get the hang of that. Been scheduling, been answering the phone, been doing all the things, the ins and outs for the most part at this point. So I'm excited to be a little more autonomous in all the things that need to be done in the clinic. Um, Definitely feeling more confident about like choice of interventions, which exercises to use, how to progress, when to progress. Um, you know, feel like I've had a good amount of patients at this point who've really seen some good improvements in whether it's just a couple of visits or, after many, but still um, seeing the progress, which is good. Been using a lot of neuro lately, eStim to NMES to stimulate some muscle fibers and get some weak connections, hopefully reconnected. Um, a lot of foot drop is kind of what we've been working on with that. That and like extension lag, just not getting full extension out of some people who have had knee replacements and stuff. So yeah, working on extension, working on dorsiflexion. No, sorry, plantar flexion. Actually, no, dorsiflexion. Yep. Oops. Yeah. So tib anterior for that. And yeah, this one guy's uh, got this numbing that he's had in his toes, and he's got pretty significant foot drop, or he had pretty significant foot drop, but been pulling together a good exercise program for him and getting him on eStim. So that seems to be working, and he seems pretty pleased with the progress so far. So that's been uh, really cool to see. Um, been doing a lot of vitals, monitoring of vitals. Um, just one of my patients, John, I did not just say his name. It's just his first name. You're not ever going to know who that could possibly be. Um, yeah, so one of my patients, that guy, he, you know, came in very lethargic one day and just kind of seemed a little bit out of it. And he's a guy I've been helping with balance and everything. So we had to adjust the treatment and took his vitals before, during, and after treatment. And every time that he's had an issue coming in a little lethargic after some light exercise, he seems to kind of perk back up, and the vitals definitely turn around and become more baseline, better, closer to regular, normal values. Um, so, yeah, him and another patient, a few others actually. So, been doing a lot of that, making sure that people are going to have a safe and effective treatment. And on top of that, working with this laminectomy patient. He was like pretty young, and I guess something happened when he was firefighting or something, and um, yeah, he had to get his laminectomy and a partial discectomy, and he's been, no bending, lifting, twisting protocol and all that. So he's been an interesting one to work with, and he's got some foot drop that we've been working on with NMES now, and um, yeah, it's interesting. One side he's got foot drop, the other side he's got like less uh, plantar flexion. So interesting how that worked out. I'm not exactly sure why that was the case, but he'll probably make a good recovery. He's doing good already, so I think he'll be back at it sooner than later. But yeah, all in all, everything's been going really well. Um, I went to the other clinic, the beach clinic, uh, to kind of see what's up there and uh, meet the people there, and hopefully, if they can't take me full time at PV, then they can take me there for some of that time also. So they were all really cool, and we got along, and um, yeah, helped out as much as I could there. They were pretty happy with it, I guess, with my work, and uh, yeah, they had like a crash in the system, like at like 2 o'clock, so basically couldn't look at exercise charts or document anything from like 2 to 4, which was pretty stressful. And so yeah, I just had to write down everything I did, which was not great, but it is what it is, and you got to adapt. So um, all in all, everything's been going really well. Super excited to start this um, next week 9. About to just crank it out, and we're on to 2 more after this. So let's get it. Cheers.